Hey everyone, this is Kieran. Today's exercise is going to be about some upper ribcage breathing. It's a really useful skill to have. We've talked a lot about in some other videos about lower ribcage breathing, and so this is a little bit different. It might be involved in situations where maybe you've had some ribcage injuries, thoracic outlet syndrome, neck injuries, shoulder injuries, things like that. So if it sounds like it's hard to breathe up in here, then give this exercise a go. So with our rib cage, we need to, and this goes for anywhere else in the body as well, but the shape of a joint dictates the movement potential there, or the degrees of freedom. And that's getting a little bit into some of the motor learning side of things, but it's important to consider that if a joint can't move in a particular direction, then the benefit of training that direction is kind of null. So for example, my thumb can do that movement, it can't go sideways. So I'm not going to try and train it to go sideways. We've got to consider those principles in the rib cage as well. Now, because of how the vertebrae are shaped with the rib joint as they connect on the back, the lower rib cage and the upper rib cage go different directions with breathing. Now, the lower rib cage is going to go sideways, and I'll put a link to the video here which I talk about that with. In the upper rib cage, though, it's going to go up. So we call this bucket handle down here, and up here is pump handle. So like an old school pump handle of when you're getting water out from a well. Now, what that means is that when I breathe in, this is going to go up. When I breathe out, this is going to go down, and this means your sternum. So if I put my hand here so you can see, nice. Now, there's a bit of a prerequisite here in that the erector spinae, or your sort of muscles that are going to control your spinal column, have to be able to have a certain amount of control. So they're holding that spine in place, which allows the ribs to be mobile. So it's not saying that the spine has to be rigid, but there has to be a certain degree of tension. So because as the ribs move, they're going to need something to leverage off of. So for a lot of people, they're going to be missing a little bit of thoracic extension. And I've got another video which I'll link here, and you guys can watch that to build some thoracic extension. And you'll notice in that exercise that one of the cues I give is as you're in the full extended position, you're actively trying to be there, and then you're actively also trying to breathe both down in here and up in here, so you can get that full inhalation and get that full rib mobility back. Where this becomes specific for some populations, so for example in a neck injury, so the muscle that's going to primarily lift the sternum up is your sternocleidomastoids. So you've got one here and one here, and they attach to that collarbone and the manubrium. And what it does is basically lifts that sort of breastbone up, right? Now, a muscle is going to struggle to shorten at both ends if it crosses many joints. This is called active insufficiency. And the same goes for lengthening. So it's going to struggle to lengthen at both ends if it crosses many joints. And the SCM is one of those muscles that crosses many joints. It attaches the head to the rib cage. And in a long position here, so if I do my chin down, that means that it's being stretched up here, and it's now has a sort of advantageous position to be shorter here, okay? So when people talk about this kind of chin tucked position, it actually makes it easier to breathe in your upper rib cage. Versus if my head's forward like this, and now it's short here, that sternocleidomastoid is short at the head attachment, which means that it's going to be biased towards a lengthened position down here, right? And it means it's going to be harder for it to shorten at this end. So it's going to be harder to breathe up into my upper rib cage. Now this position could be for any number of reasons. The position inherently is not bad. It's can you get out of it if you need to. So that'd be a nice upright position, walking, running, reaching upwards, rock climbing, that kind of stuff. So that's where the thoracic stuff comes in as well. So you guys can see there's a bit of a layered thing going on here. And usually the breathing or the bracing of the breath is a compensation to provide some form of anchoring off the ribs, instead of that spinal column being the anchor and the ribs being nice and mobile and being able to breathe. So we can train that on the ground. We'll go over a couple props and situations you can do that. The second thing is thinking about thoracic outlet syndrome. Now, thoracic outlet syndrome just being that there's multiple things going on. We can't necessarily say that it's this thing, and therefore thoracic outlet syndrome is not necessarily a diagnosis. It's a collection of symptoms for varying reasons. One of the things that can happen, and this may not be if there's a structural thoracic outlet syndrome, maybe more of a functional, but there's always a bit of a blending of both, is that the scalenes here, they're accessory breathing muscles. They attach to those first and second ribs, and they elevate those as well. So they help you get that extra little bit of breath in. Now, those ribs are also attached to that sternum and manubrium, so that when this lifts up, those also are elevated up during an inhalation, and you can get assistance with your scalenes, right? Now, if we think about that same active and passive insufficiency rule again, the attachment points, we look at the angle here, and maybe I'll bring up a little anatomy picture for you guys to see as well. We've got an anterior scalene and a middle scalene. The anterior scalene is a little bit more on this angle, and the middle scalene is a little bit more, you can't see it so much here. It'd be more if you're looking at like a sailboat from the side, and it's on an angle coming down this way, but I'll show you guys on that anatomy app. But if it's short at one end, it's going to be hard for it to shorten it at the other end. Now, this forward head position posture sort of compounds the situation, because the attachments on the side of the neck here, the transverse processes, are now forward, which means that they're short at the neck attachments, which is going to make it hard again for it to actively pull up at the rib, right? Versus if I'm here and all the loudest thing, or the thing that looks like it's moving the most, is the head, I'm thinking about the actual neck moving backwards relative to my rib cage here, okay? So if I'm pulling my neck back, that means I've got that thoracic extension to be able to do that. So this part is going back. It's now over my rib cage, as opposed to my head being back. You can see my neck hasn't actually gone, versus my neck coming back. And that's a little bit different. I'm not doing a whole bunch of bending down here. Neck coming back means that now I'm a bit longer at this neck attachment, which means the rib portion has more of a mechanical ability now to shorten and inhale and get that top end range, okay? So it's tricky in this scenario if this skill is hard for you, because you're going to be fighting your own tension, the tension that's probably helpful tension you've created as a strategy to keep you sort of moving day to day. So as always, you can lay down on the ground, and that's a nice supportive option. And we'll go over a couple options if some of the neck and rib cage, the neck and thoracics extension is a bit of an issue, all right? So if I were to, I've got this yoga block here, and I'm gonna lay down. Now, the first thing for a lot of people that maybe have that forward head situation, again, not bad, but can you get out of it, is they might lay down and they might feel like this. And they might feel like they're really stuck and they can't relax the head down. Use a pillow, use a yoga block, use something to just prop the head up. And over time, you reduce the assistance that's needed there, okay? Now, we talked a little bit about the active extension of the thoracic spine, so that ability for you to create not a rigid vertebral column, but something that the rib cage can anchor off of. So there needs to be a certain amount of tension there, something that you can pull off of, and it's not just gonna, be relaxed and sort of be all over the place. Not that it would be, you've got a robust spine, but what's gonna help is just think about trying to touch the sky, for starters, with your chest. And so I'm creating some extension there. For the sake of the exercise, I'm exaggerating the situation, okay? So I'm up like this, and automatically what I've done is I've brought my sternum closer to my chin. So just by doing that, I'm sort of helping myself get into the position which is going to make it easier to breathe, okay? Now, when we're learning new skills, it's a lot easier if you have something external to focus on. So instead of thinking about, okay, lift this body part, feel that body part, choose like a weight, put it on the sternum, and when you breathe in, that weight's got to go up and towards your face, okay? So weight's got to go up as I breathe in, and then it's got to go down. You can breathe at whatever pace you'd like, fast, slow, long breaths, short breaths, I don't mind. Just get that thing up and down. All right, so created this arch. Yes, my lower back's arched a bit, that's fine. I'm trying to lift myself away from the ground, and then I'm gonna try and hold that as I breathe up and down here. And as I get better at the movement, I'm gonna be able to relax my head further and further down, and my head's just relaxed here. I'm not actively creating tension up at my neck, okay? So I'm here, and same thing. And then now exhale. And you'll feel on the exhale that your head wants to get dragged into that position. And that's normal, right? Because now as you're exhaling, all this stuff's wanting to lengthen and go long, which means the other end's got to go short, right? So you can see there's that bias. So passive support, pull yourself up into this position if you can't relax, lie relaxed in a straight position here. Have an external weight to help give you some information and some feedback. The goal is for this to move. I want you to focus on that moving. And you'll just start to find that it gets a little bit easier and easier to breathe. The work of breathing gets less. And that's an important point. We want it to feel not so effortful just to do a relaxed breath, okay? And then later on, you can take this into more active positions. So for example, a pull-up, an overhead position is going to require a lot more independence of these areas. So if I'm up here, it's a lot harder to breathe up into that sternal area. But doable. Or if I'm in a squat or a bench press or rowing or anything like that, I still want to have this capacity if I'm getting towards my maximum effort, because that's what this strategy helps us do. So we're at max effort, we can start to breathe more up in here, and it can help us just get a little more oxygen and a little more CO2 out. But ideally, you've developed this lower ribcage breathing strategy as well, so that it's kind of happening in a subconscious way. All right? So hopefully that makes sense. As always, these exercises are best understood through feeling and experiencing them and experiencing the success of the movement. That prior experience is what's going to create the change later on. It's going to get you more confident in doing the thing, and then it's going to help you feel like it can transition into other skills as well. So there's a lot of chat. You can kind of conceptualize a lot of this and talk about it and make it a cognitive thing, or you can just kind of get down and do it. The weight's not important as far as the degree of weight. Just choose something that feels like it's giving you some feedback, okay? So really underrated area, not underrated, sorry, but really underutilized area to train. It kind of gets demonized a bit. I really encourage you to develop that skill along with the lower rib cage, and you start to get a complete picture of what it means to get full rib cage flexibility when you're breathing, and then it can transition nicely into both a relaxed and an active environment. All right? So if you've enjoyed this, please leave some comments, ask some questions, and if you're more interested, then I can have a look at the articles that I've written up, linked in the description. If you like this video, then please hit like below. Otherwise, to check out more of our content in the future, you can subscribe to our channel by clicking our logo over here. And to check out our latest video, click up here.